Hello, everybody, and welcome to our Reopen with Reuse live stream. My name is Brooke Gatewood. I'm the host of the Indisposable podcast with Upstream Solutions and your host today for this conversation. So today's event is an extension of our Unwrapped project, a global collaboration between Upstream, Zero Waste Europe, and the Global Alliance for Incinerator Alternatives, aka Gaia, to exposing the health impacts of plastic and food packaging chemicals. This project held an international conference in 2019, which brought together plastic pollution advocates from across the world and internationally recognized environmental health and toxicology scientists to learn from each other. Advocates learned about research on the environmental health impacts of hazardous chemicals in food packaging, and scientists learned from community representatives about which research questions were most relevant for communities impacted by the pollution life cycle of plastics. Now, led by the Food Packaging Forum, a group of 30+ scientists developed a scientific consensus statement on this topic, which included a protocol for the systemic evidence mapping of migration of chemicals from food contact articles into food, as well as a database of chemicals intentionally used in the manufacture of food packaging and other types of food contact articles. In lay terms, their statement recognizes that reducing exposure to hazardous food contact chemicals would contribute to the prevention of associated chronic diseases in the human population, which is not something we hear about every day when we talk about the impacts of plastic pollution. This work was published in the peer-reviewed journal Environmental Health in 2020 under the title Impacts of Food Contact Chemicals on Human Health Consensus Statement. And it's been shared by hundreds of media outlets and organizations addressing plastic pollution around the world. So in recognition of World Health Day, which is tomorrow, April 7th, we decided to put together this event to give you a small taste of what we've been learning the last few years from researchers on this topic. And we're so honored to get to learn today from Dr. Leo Trisande, who's a pediatrician, environmental pediatrics researcher, and author of Sicker, Fatter, Poorer, as well as Dr. Shauna Swann, one of the world's leading environmental and reproductive epidemiologists and author of the newly released book, Countdown. Before we dive in, it's important to be clear that our esteemed guests are not here to promote Upstream's vision for reuse so much as to share with us what their research has revealed and their own views on the kinds of public health and policy solutions that will support a healthier world. We're honored to have them both join us today to help us all better understand some of the many complex health implications of plastic and food packaging chemicals. As an advocacy organization, Upstream is thinking about how the health threats of so many chemicals found in single-use disposables can support the case for reuse, especially non-plastic packaging. So we'll round out our discussion later in the hour with some thoughts from Upstream's policy director, Miriam Gordon, about why in the midst of a pandemic that has exacerbated the plastic pollution crisis, reopening with reuse makes sense for personal and public health as well as for our shared future. In addition, tomorrow we'll be launching a consumer statement in partnership with Oceanic Global, Clean Water Fund, and Safer States about the need for restaurants to reopen with reuse and how consumers can help raise awareness about the health impacts of single-use and toxic plastic products. We'll then open it up to some audience questions, and since today's webinar is also a reporter briefing for World Health Day, special welcome to journalists who are here with us today, and we'll get to as many questions as we can, but we will prioritize reporters' questions. So if you're a reporter, please let us know that you're with the press when you enter your questions into the chat box. Lastly, for those who want to network with others on today's call and discuss the session afterwards, we will host a 30-minute speed networking starting at the end of the hour. So stay tuned for details on that as we get to the end of our hour. So without further ado, I would like to introduce Dr. Leo Trisande, again, MD, MPP, author of Sicker, Fatter, Poorer, public health policy and environmental health pioneer. Dr. Trisande is a Jim G. Hendrick, MD, professor, vice chair for research in the Department of Pediatrics, and chief of the Division of Environmental Pediatrics at NYU School of Medicine. He also directs the NYU Center for the Investigation of Environmental Hazards. And I remember being especially riveted by his presentation at our Unwrapped conference a few years ago. And Dr. Trisande, thank you so much for joining us and look forward to hearing your remarks.
Thanks for having me. So when I was a medical student in the 1990s, I would have to say that chemicals in food packaging were not a prominent issue in the medical curriculum. And in fact, we were taught this notion that only the dose makes a thing a poison. We thought chemicals used in a variety of products were generally safe for broad use. There were a few mistake chemicals here and there. And essentially, we could go on with our daily lives and focus on treating patients more so than preventing. Boy, has my career really turned that notion upside down. So the few chemicals we've studied suggest over 1,000 at least that scramble our natural signaling molecules, our hormones that underlie everything from maintaining a healthy body temperature, good metabolism, salt, sugar, even sex. And that's just based on what we've tested. The evidence is strongest in particular for 5 categories of chemicals. 2 of them I'm going to set aside. We're not going to focus on them as much today. Flame retardants used in electronics and furniture, pesticides used in agriculture. 3 of them are increasingly used in a variety of food packaging materials. Bisphenols used in harder plastics, also in cosmetics and personal care products. Phthalates used in softer plastics, typically. I apologize. Bisphenols used in aluminum can linings, thermal paper receipts. Phthalates used in softer plastics, typically in personal care products, cosmetics, and food packaging. And then the perfluoroalkyl substances are forever chemicals that are increasingly used, not just in nonstick cooking and oil and water resistant clothing, but are also used in polymers used to make more and more plastics as time goes on. So at first we realized that these chemicals hacked and damaged the brains of young children in particular. Particularly the evidence is strong for flame retardants and pesticides in that respect. But what we also know is that these chemicals can literally make us fatter. So to take the example of phthalates, we know that certain phthalates used in food packaging literally change how our body responds to a typical diet. So let's say you've had a good protein-rich meal, you've had a good workout on a given day, and you're assuming that protein you've eaten is going to go right into muscle. The phthalates that we're talking about divert energy ultimately from healthy development of muscle into fat, ultimately. The perfluoroalkyl substances or forever chemicals do something even more sinister. One study ultimately found that these nonstick chemicals slow the body's resting metabolic rate, literally the body's thermostat, such that after successfully losing weight through a healthy diet and physical activity intervention, they regained that weight back despite maintaining the best diet they could and a healthy physical activity profile, and ultimately gained more weight back in relationship to the levels of the perfluoroalkyl substances that were measured at entry into that particular study. We also know of a host of other chronic conditions that ultimately arise out of exposure to these endocrine disrupting chemicals. Bisphenols in the harder plastics are synthetic estrogens and are particularly toxic to the developing ovary as an organ of great concern. They also, by the way, make us fatter, and potentially even contribute to heart disease. We know that bisphenols antagonize the protein that's protective of the heart called adiponectin. The evidence is growing by the day that these chemicals don't just contribute to obesity, they also contribute, and heart disease, they contribute increasingly to diabetes. We've seen long-term studies show that bisphenols and phthalates either make the body less sensitive to insulin, making us insulin resistant, or actually contribute to the incidence of diabetes. So we're functionally sicker and fatter as a result of these early life, especially early life, exposures to these chemicals commonly found in food packaging. But it's important to know that life is a window of susceptibility to these toxic chemicals. And that notion I talked about at the top, that only the dose makes a thing a poison, is increasingly being unraveled. These are all studies I'm talking about that have identified effects of these toxic chemicals at the very lowest levels of exposure. We used to think that we could extrapolate from the highest doses in a typical experiment to figure out what would be a safe level for all of us humans to live with chemicals in our daily lives. But we realized that chemicals and hormones don't follow straight lines. They can go steeper than the normal line relationship we're used to thinking. And little things, especially in children who are susceptible due to their developing organ systems, really do matter. In addition, there's a lot of evidence suggesting U-shaped or roller coaster ride response functions, where you can't even assume that low dose exposures are safe based on high dose exposure studies. Now, let's just boil it down before we talk about the hopeful part of the story. So ultimately, the chemicals that we're talking about in plastics are being sold by companies that ultimately make a profit. Now, I'm not suggesting that we necessarily zero out all plastic use. There are situations where in medical devices, that may be the only alternative available at the present time. However, we have fundamentally misbalanced our relationship with plastic and human life, ultimately. And we ultimately pay as a society. So when I teach undergraduates in environmental health, I talk about Adam Smith, the father of modern economics, as an environmentalist. And that doesn't seem to pop right into natural notions. But the fact is that when chemicals harm human health, they cost all of us. And that cost to society isn't ultimately incorporated in the bottom line and in that price decision about what the societal price is of these chemicals. So we've done a series of studies over the past 5 years documenting that hormone disrupting chemicals cost the United States $340 billion, that's billion with a B, each year. That's 2.3% of our gross domestic product. So this is a toll that we all bear as a society, and it's not incorporated in the price of a consumer product. So ultimately, we all pay as a result of these toxic exposures in our lives. So that all sounds doom and gloom. I'm not here to give you that as your takeaway. And I do look forward to discussing the science and what we can do further. But let me give you some safe and simple steps at this point to reduce the exposures to hormone disrupting chemicals. So, we talked at the top also about flame retardants in electronics. When it comes to, flame retardants and pesticides. When it comes to pesticides, eating organic is a proven way in high as well as low resource populations to reduce your level to those chemical exposures. Even recirculating the air and using a wet mop can substantially reduce the level of persistent organic pollutants that can also disrupt hormones. But we have to renegotiate our relationship with plastics ultimately in human life. And that really comes with using as little plastic as possible. And this notion that we can simply reuse plastic is problematic because of the basic chemical makeup of plastic. There are chemicals literally not bound to the plastic liner that resorb readily into food and into our bodies as a result of using and reusing plastic, particularly when you microwave or machine dishwash plastics. And that's because the heat and harsh chemical ingredients resorb that plastic by breaking down polymers into monomers. That's really what a plastic is. It's a chain of molecules all strung together in a nice bow. And ultimately that makes the material hard or soft and sturdy. And ultimately that breaks down with time, as you might anticipate. The plastics in particular to avoid go by the recycling numbers 3, 6, and 7. 3 is for phthalates, which also mess with the male sex hormone, but I'll leave it to Shauna to explain the effects on reproduction of phthalates in particular. 6 is for styrene, a known carcinogen, and 7 includes those bisphenols that are estrogenic and can also make us fatter. In particular, we have a lot of gaps about what we know, but that would actually magnify all the issues I've talked about. There are a lot of non-intentionally added substances that in the eyes of the Food and Drug Administration get a pass, basically, through generally recognized as safe exemptions. So if an industry representative or scientist says it's okay, it can simply be vouched for, and the FDA doesn't have the same degree of oversight over those chemicals commonly used in food packaging. So there's a balance here. We're talking about steps that we can take as individuals, but we also need to rise up and speak. And I'll just leave one other message of hope, and that is that when consumer activism rises up and is the change it seeks, it can produce substantial change. When I think of BPA, when it was phased out of baby bottles and sippy cups in 2008, that wasn't the science at the time. It was rising quickly. It was families, mothers specifically, calling for companies to change their manufacturing practices. They ran to the FDA and got the ban of BPA in baby bottles and sippy cups. More recently, we've seen PFAS get removed by 2 major supermarket chains from a simple study of 5, just 5 food packages. So these kinds of consumer movements speak to the power of the purse or wallet in being the change we seek. So that's why I get up every day smiling and happy and ready to dive back in rather than depressed with all this really urgent need to act. Thanks so much.
Thank you so much, Dr. Trisande. There's a lot of good information you just gave, and I love the simplicity of remembering 3, 6, and 7 in terms of the recycling numbers, and we could start by paying attention to and avoiding those. So I just want to remind our audience, if you have questions, please direct them into the Q&A box, which is at the bottom of your screen, and we will circle back to questions after we've heard from all of our speakers. So I now want to hand the mic over to Dr. Shauna Swann, PhD, MS, and as mentioned before, leading environmental and reproductive epidemiologist. She's a professor of environmental medicine and public health at the Econ School of Medicine at Mount Sinai in New York City, and has spent the last 25 years investigating the alarming drops in sperm counts and identifying the devastating power that chemicals used in everyday products have in altering men's and women's ability to conceive and deliver a healthy baby. What Dr. Swann found was so disturbing that she felt compelled to write the recently released book, Countdown: How Our Modern World is Threatening Sperm Counts, Altering Male and Female Reproductive Development, and Imperiling the Future of the Human Race. So on that cheery topic, Dr. Swann, please tell us more.
So thank you so much, and I'm happy to be here. I have not very many slides, but I thought it would help to walk you through a few images and as I'm talking. So I'm talking about specifically a threat to reproduction because I'm a reproductive epidemiologist, and because Dr. Trisande has done so well talking about lots of other adverse outcomes. So let's see. Oh, I'm sorry. I don't know what just happened. I was trying to click to the next slide, and there it is. Okay, so I'm going to talk about the problem that I see that we're facing, largely an unrecognized problem, I think, because people don't talk a lot about their reproductive problems. And then I'll talk about causes, consequences, and solutions. So when I talk about reproductive problems, I'm not just talking about women, who are usually actually blamed for the reproductive problems that couples have, but both men and women. And when I talk about the male side, I'm not just talking about sperm counts, which might be the most obvious. I'm also talking about changes in the genitals themselves and a reduction in testosterone, genital birth defects. And on the female side, some less obvious things might be the menstrual problems that we don't think about too much, endometriosis, premature egg depletion, and the overlap of males and females are affecting our infertility. Both males and females can have ambiguous genitalia, hormone abnormalities, low libido, and so on. So it's a complicated problem affecting both males and females. But when we talk about the males, the most dramatic thing, I think, is this decline in sperm count and concentration, which we published in 2017. And what we did in 2017 was a meta-analysis. So we took, all the world's literature, but it turned out that there were really not very many studies from countries other than Western countries, which is North America, Europe, Australia, and New Zealand. Well, what you see here is very dramatic. These are the years of sample collection, not publication. And so the first samples were collected in 1973, and they went as far as 2011. And in that short time, this is the median sperm concentration, that's the middle of the distribution, if you will. The drop was slightly over 50%, from 99 million sperm per milliliter, quite a lot, down to 47, which also sounds like a lot because it's in millions, but in fact, 47 is quite low. And when we get to 40, we get to the point where couples are having trouble getting pregnant and it takes longer to conceive. And then I was asked to do something I'm reluctant to do because I'm a statistician, but I was asked, what happens if you extend that line? And you can mathematically extend that line, and it hit 0 in 2045. However, a caveat here, this is a median. That means that if we really interpreted this literally, it would say that half of men have negative sperm count. Well, that's not possible. You can't have a negative sperm count. So really what's happening, or what we might predict, and people ask me that all the time, I would say this has to level off sometime. The question is, how fast is it going to do that? And I think that has to do with how much we control the factors that are affecting this decline. So what are those factors? Well, when we talk about causes of adverse health effects, we can talk about genetics, which I think is not an issue here because we're looking at changes over 2 generations. This is much too fast. So then we have environment, and environment itself can be broken down into lifestyle and chemical exposures. And I'm not going to talk much about lifestyle factors. This is not what this session is about, but I'm going to talk about chemical exposures. And among chemical exposures, the ones of most concern to me are those that, as Dr. Trisande said, can impact our hormone system. And the reason that's so important for reproduction, because our entire reproductive health is driven by the health of the steroid hormones, particularly, and other hormones in our bodies. So under these endocrine disrupting chemicals, we have the 5 classes that Dr. Trisande talked about, and I'm going to focus on 2 categories that are in plastics, which are the phthalates particularly, and might say a few things about the bisphenols. But keep in mind that these other chemicals are also playing a role in reproductive health. So my goal here is to convince you about just one little bit of science, and that is that we really need testosterone for the normal development of the male genital tract. This is a very simple diagram, and what you see on the left is what's called undifferentiated, no difference between males and females. Then testosterone comes along at the right time, and it produces the male typical, that is for individuals with an X and a Y chromosome, that sex typical development of the genitals. And without the presence of testosterone, that will be female. Okay, so what does that mean for our story here today? What can interfere with testosterone? Well, phthalates. Phthalates found in milking machines. This is a farm, an organic farm that has a milker that uses plastic tubing, soft plastic tubing, which contains phthalates that are not chemically bound, as you've heard, and the phthalates can leave the plastic and go into the milk, so that even organic milk could be contaminated. They're in our shower curtains, in our personal care products, but here we're focusing on the food, the contributions phthalates to food, and not only milk processing, but processing of tomato sauce and spaghetti sauce, and anything that goes through plastic tubing or comes in contact with plastic can pick up these phthalates. And so they have that gives them the ability to interfere with testosterone. And I don't have time to go into the science very deeply, but I'll tell you that in 2005, an important paper defined what we call the Phthalate Syndrome and showed that when the mother rat was exposed to phthalates in early pregnancy, that her offspring had a number of changes, unexpected changes, which they called the Phthalate Syndrome. It's kind of interesting because there's not too many chemicals that have a syndrome named after them. This is really important syndrome, and there are smaller genitals, malformed genitals, and also internal changes that we couldn't look at in humans. But I wondered, could this be happening in humans? And so I took a study that was ongoing at the time, in which we had enrolled pregnant women and collected their urine during pregnancy and asked whether the phthalates in those urine samples could be related to the genital development of the male offspring. So we looked for the Phthalate Syndrome in humans. By the way, the only way you can know, of course, whether somebody is exposed to phthalates is to measure it in their body, because we don't know how much, I don't know how much I have in my body right now, you don't. And fortunately, these are water soluble, and so we can measure them in the urine. So that's what we did. And we did that in 2 studies. So the first study, which was published in 2005, showed that phthalates in the mothers were exposed to during pregnancy, but the timing was not very specific, did relate to the genital development of the male offspring. Then we were fortunate enough to get refunded and do it again. And that was amazing. And the second study, which is actually ongoing, called Tides, and I'm working with Dr. Trisande on that, confirmed that finding. And that was important for a number of reasons. First of all, we did it much more carefully. The study was specifically designed to look at that. The timing was important, and we had very, very careful measurements of the outcomes. And what does this have to do with sperm count? Well, those children that were born, obviously we couldn't measure their sperm count. They don't have one. And we couldn't wait 20 years to ask that question. So we did another study. And in this third study, what we did was we took adult men and we measured their anagenital distance. And this is a measure which is sensitive to testosterone and which is altered by phthalates, shortened by phthalates. And that turns out to be a really good way to ask how much androgen, how much testosterone did this boy experience, or actually works on the female side too, did this female experience during pregnancy? And so this is actually thought to be a permanent marker based on animal studies. And so we brought in these young men, measured their anagenital distance, got their sperm count, and saw that the higher the sperm count, the longer this distance. So there did seem to be a signal at birth, which was altered by phthalates, which then could lead to lower sperm counts. And another study in California showed it was also linked to infertility, that men who had never born a child also had a shorter anagenital distance. So you have a pretty good set of studies here from the animal study, and actually there were in vitro studies as well, showing the anti-androgenic action of phthalates. And then you have the animal studies repeated, of course, and then you have the replicated human studies. That chain of studies is actually enough, I feel, and other scientists feel, to establish causation of phthalates in reducing sperm count. But the timing is really critical. And what they showed in some very delicate and beautiful animal studies, that there was actually a 3-day window for rodents during which the phthalates had to be administered in order for this change to occur. We looked in our human studies. Obviously, you can't assign an exposure to a pregnant woman, give her phthalates on this day or not this day, absolutely not. But you can measure urines at different times. And when we did that, we showed that it was only in the first trimester that you saw this association with this critical measure, the anagenital distance. There's other ways that timing is really important I want to mention. So for that, I'm just going to go to smoking because we don't have this information for the phthalates. But it turns out if the man smokes around the time of conception or in the few months before, his son will have about a 40% reduction in his sperm count. If the mother smokes in early pregnancy, her son will have a 40% reduction. Those reductions are permanent. They are not fixable. Those are lifetime deficits. However, if the man himself smokes during adulthood, he has less of a reduction in his sperm count, and he can fix that by stopping smoking. So I think the critical message here is that the exposures that the fetus has in utero, particularly in critical windows like the first trimester that we showed, those are permanent, lifelong changes. And by the way, I don't have a lot of time to go into it, but there are also consequences for later generations. Another consequence that I want to mention is that sperm count and fertility is not just about having babies, because it turns out that men with poor sperm counts, low sperm counts, or infertile men actually die earlier. They have higher heart disease, higher rates of obesity, diabetes, and more reproductive cancers. So, and probably other things. So what you're seeing in low sperm count is a signal that something went wrong in early pregnancy, probably, that can play out throughout the lifetime. So I'd like you to keep in mind that even if you're not interested in having a child, you should have your sperm count checked because it can tell you something about your whole life's health. And then I just want to briefly mention that this is not just about humans, that the same declines in reproductive function are occurring in wildlife all over the world in many, many, many species. And when people tell me that the declines in fertility are due to people choosing to have their children later, yes, that's important, but I will tell you that these guys on the screen right now are not choosing to have their children later. And finally, I want to say a couple of things that are helpful and encouraging. This study from Pat Hunt in the University of Washington showed that when the exposure dropped so that only the father was directly exposed and the son less directly exposed, and then there was no further exposure, after 3 generations, the problems could be reversed. So these are not, what I'm talking about are not forever chemicals. They're chemicals with short half-lives. And if we keep them out of our bodies and our pregnant women's bodies and our fetuses' bodies for several generations, we can get back to the good health that we experienced before the advent of the growth of plastics. And finally, I just want to briefly talk about 3 solutions I want to suggest. And my book, Countdown, has many, many solutions discussed, some of which Dr. Trisande talked about and many other ones. And but in general, I think the problem is that we have to remove from commerce chemicals that are hormonally active. I think probably everyone on this call will agree with that. We have to remove chemicals that cause harm at low doses, at which they are not tested, as Dr. Trisande explained. We have to remove those that are environmentally persistent because they will come back to bite us, so to speak, later on, even though we don't, we're not aware of taking them in. And we have to remove those many, many chemicals that have never been tested, those that are grandfathered in, those are generally recognized as safe. And we have to replace those with chemicals that do not have endocrine disrupting properties that are free of low dose adverse effects, that are not environmentally persistent, and have been tested prior to marketing and shown to be safe, as is done more commonly in Europe now under REACH. And finally, we have to regulate these in a way that protects our health. We have to regulate them in human relevant scenarios. We are exposed to low doses, we're exposed to mixtures, and we have to regulate their environmental impacts, and finally to examine the risks in untested chemicals. So I'm going to stop there and just tell you that you can, this is an old slide, it shouldn't say pre-order, the book is out, you can get it, and I'll stop there.
Thank you so much, Dr. Swann. A lot of good questions coming in the chat. And again, we will get to those at the very end. But first, I want to introduce Miriam Gordon, who is founder of Rethink Disposable, now Upstream's policy director, lawyer by training. And as many of you on the call know, Miriam's been a lead strategist and thought leader in ways to reduce single-use plastic for since 2005 or so, though she actually started her career working on hazardous waste and reduction to toxic exposure. So this is a nice coming together of worlds for Miriam. And so she's going to share a little bit about her perspective on why this all is further evidence that reuse is a good pathway for us, at least as part of the solution. I know Dr. Trisande and Dr. Swann mentioned other important pathways for change as well.
Thank you, Brooking. So first of all, I just want to say that introduce Upstream to those of you who don't know Upstream. Our organization accelerates solutions to plastic pollution that focus on reducing throwaway packaging. Solutions like reduce and reuse not only cut the waste, they eliminate the climate impacts of single-use products while also protecting human health from the threats associated with plastics and harmful chemicals. Let's see. But since COVID-19 hit, reuse has been under attack. At the very outset of the pandemic, the Plastics Industry Association sent a letter to the Secretary of Health and Human Services requesting that the agency make statements that plastics are essential to stopping the spread of coronavirus. Now, HHS oversees the Food and Drug Administration, which regulates the food service industry. Health departments follow FDA's guidance with respect to food safety. In the letter, the Plastics president and CEO suggested that single-use plastic products are the most sanitary choice and asked the department to speak out against bans on these products. Now, while plastics have been widely used to protect all of us from the spread of the virus, and it's been essential in the healthcare setting, the need for single-use plastic to prevent the transmission of COVID-19 in food service is a fiction perpetrated and perpetuated by the plastics industry. The science offered by the industry in that letter had nothing to do with COVID-19, and all the studies were really junk science recycled from the playbook that the industry has been using to stop the ban of single-use plastics and promote reusable bags. The idea that single-use plastic grocery bags and food packaging are useful in preventing the transmission of COVID-19 presumes that touching surfaces of reusable bags, cups, and containers contaminated with the virus can make us sick. But surface transmission is not how the virus spreads. According to national and international health agencies, including the Center for Disease Control, the virus spreads from person to person, most commonly during close contact and sometimes by airborne transmission of aerosolized droplets, but not by contact with contaminated surfaces. Generally, masks and hand washing offer enough protection. In February of this year, the acting secretaries of the USDA and the FDA stated that during the year of COVID-19, with over 100 million cases of COVID worldwide, there hasn't been any epidemiological evidence of food or food packaging as the source of coronavirus transmission to humans. Although the industry narrative that single-use plastics in food packaging and food service makes us safer is not supported by real science, the fiction has resulted in a significant uptick in using disposable products, The practice is nothing more than hygiene theater. It provides employees and customers with an illusion of protection against COVID-19. Plastic pollution before the pandemic was already at crisis levels in the environment. As much as 13 million metric tons of plastic waste was estimated to be entering the marine environment from land-based sources in 2010. In 2016, the US ranked as #1 in plastic waste generation globally at 42 million metric tons, and much of our waste was either littered or dumped, or it was exported to other countries where it became their pollution problem. Oops. In the first few months of the pandemic, consumption of single-use plastic had grown by 250 to 300%, according to the International Solid Waste Association. And a 30% increase in waste generation in 2020 was attributed to PPEs, packaging, and disposable foodware. In the US, online shopping and takeout services increased by 78% during the pandemic, the highest increase of several countries, including China and India. And COVID-19 has fueled an increase of 5.5% in the annual growth rate of plastic consumption. In response to COVID-19 and the concerns around surface transmission, state governors and legislatures delayed or suspended plastic bag bans in numerous states. And although these restrictions have been lifted in most, Maine and Washington still have them. Similarly, states moved to suspend polystyrene bans and bottle deposit return programs, and a wide range of local health department orders and state health department orders followed, including those that stopped the use of reusable cups and bags and bulk bin shopping in grocery stores, and recently enacted policies promoting reuse for takeout cups and on-site dining. Exercising an abundance of caution approach and participating in the world of hygiene theater, state and local health departments also encourage food service operators to use disposable foodware, even though the FDA had not recommended this practice. Even grocery stores and food chains stopped allowing customers to bring their own reusable cups or reusable bags. The increase in disposable foodware means that consumers are even more exposed to hazardous chemicals in food packaging. As Brooking mentioned at the outset, as part of the Unwrapped project, the Food Packaging Forum led a group of 33 scientists, including Dr. Trisande, in the development of this consensus statement about the impacts of food contact chemicals on human health. One of the main focuses of the statement addresses concerns about the health effects of chemicals that are added to food packaging to provide various functions, like increasing shelf life of foods, making packaging more grease or moisture proof, making plastics hard or flexible, and allowing printing and coloring. In sum, the statement tells us that there are over 12,000 chemicals used in food contact materials. Many are hazardous to human health, but a large portion, approximately 70% in the US, have never been tested for health effects, so there are huge knowledge gaps. Food packaging is estimated to be the most significant source of human exposure to plasticizers, like the bisphenols and the phthalates. 63 chemicals in plastic packaging are identified by the Food Packaging Forum as particularly harmful to human health. The Unwrapped project has translated the science for lay people regarding the health effects of plastics and food packaging chemicals and described the worldwide regulatory failures to protect our health from these risks. So I urge you to visit unwrappedproject.org. In addition to the lifestyle choices and safer chemical solutions offered by Dr. Swann and Dr. Trisande, Upstream suggests that we move towards non-plastic reusables because they are safer for human health. When made from glass, stainless steel, and ceramic, there are fewer chemical additives that can migrate out of the package. Seals, gaskets, lids, and resin liners in metals to prevent corrosion can transfer some chemicals of concern, but on balance, these non-plastic materials are safer. And reusables are also a win for the business bottom line. According to the Ellen MacArthur Foundation, just a 20% transition to reusables represents a $10 billion cost savings opportunity for businesses. And this has been proven time and again on the ground by projects like Rethink Disposable that are showing businesses can save money with reuse even after purchasing reusables and paying for the cost of dishwashing. And reusables are also better for the environment. In our review of life cycle assessments of disposables and reusables, it shows that reusable products are beneficial to the environment provided they are used an adequate number of times, anywhere from 2 to 50 uses, depending on the product. And reuse builds thriving local economies by providing more jobs than our waste system, 30 times more jobs than in landfill and incineration. So what does reopening with reuse look like? Well, in takeout and delivery, there are companies like Dispatch Goods, where you can order a meal directly from a restaurant through DoorDash or through the restaurant, and it'll be delivered in reusable and returnable containers collected from your home or office for washing and reuse, or reusable cup companies that are popping up in cities all over the world that makes it so that you don't have to bring your own cup. You can borrow one from the cafe. And again, there's the back-end logistics are provided for collection, washing, and redistribution. And there are new companies that are working to bring refillable beverage bottles back, like Conscious Container, which is working on beer in the beer and spirits industry and planning to enter the water and soft drinks market. And then there's on-site dining, where reuse can go back to the way that it has always looked in about 60% of restaurants nationally, where no disposables were used for on-site dining. Even McDonald's provides reuse for on-site dining to their customers in Europe. So why can't we have that here in the US? And then there are new dishwashing innovators like Dishcraft Robotics that are lowering the cost of dishwashing for the food service industry. Oops. So in conclusion, because reuse is safer for our health, better for our planet, and saves businesses money, tomorrow, in honor of World Health Day, Upstream and our partners, Oceanic Global, Safer States, Clean Water Action, and other co-sponsoring organizations are launching a consumer sign-on statement calling on our restaurants and local food service businesses to reopen with reuse. We hope that you'll join us in calling on our treasured local restaurants to reopen with reuse to protect our health and our planet and rid our city streets and ocean of the scourge of single-use plastics and throwaway packaging. And if you want to learn more about how Upstream is working to enact policies that ban these concerning chemicals from food packaging and promote a drive towards safer reusables, please sign up for our weekly email or follow us on our social channels. Thank you.
Thanks, Miriam. Okay, so we have some questions in the chat, and of course, we can't get to every single one of them, but I'm going to couple a few of the questions. I think a lot of our listeners are, first of all, I just want to name a question that we're probably not going to answer live, but a number of people are thinking, should we be thinking about trying to organize some sort of ban on phthalates? Because so clearly this is a problematic product. So that was the question that came up. But since we have science experts with us, I'm going to stick to the science questions. So people were curious about if you guys have anything you're able to share about PLAs and compostable lining and what you know about risks with those. A lot of people wondering about number 5 recycling and if there's any risks or concerns we should know there. And then the third question I want to highlight was around an environmental justice question of if these chemicals are coming in through the packaging, are they also in the air in communities where they're being manufactured, in landfill areas as well? So you guys might be able to respond to some or all of those technical questions, but I thought I'd just lay them out and see which ones you're able to speak to.
I can jump in on the disparities question. So we know that low-income communities and communities of color suffer disproportionately from the burden of disease due to endocrine disrupting chemicals. And that's because they have higher exposures due to multiple pathways of products that are sold and used. And that is a double injustice. It's no secret that there is a longstanding history of environmental racism, and that implicitly is another form of environmental racism, wherein communities who should not be suffering disproportionate consequences are suffering disproportionate consequences because of substantial exposure. The main routes of exposure to the chemicals we're talking about today are really diet, but it's also absorption through skin, among other pathways. I would say airborne exposure is not as predominant for these particular pollutants, though air pollution is a classic form of environmental racism.
Could I just add then to that excellent summary, the fact that we're finding that the impact of an exposure at the same level in a community that's disadvantaged will be greater, because they're starting from a baseline of health problems and stress and inability to cope with before the impact, and then you have the increased exposure and you have a greater. We're just publishing a study on that, of the differential effects of bisphenol A in a community with higher with disparities. So I'd like to keep that in mind. Not only is the exposure higher, but at a given level, the impact can be higher.
And I'd just like to add on, even though I'm not a scientist, we did in the Unwrap project look at this question, and I'll pop a link to a report that we published where we found that it's very likely that communities that lack access to fresh food, that are eating mostly packaged food, which is a problem mostly only in the US, we found, are disproportionately impacted, because they're most of the food that they're eating is both processed and also packaged in single-use packaging.
Great, thanks. What about the questions about the compostable lining? A number of people were interested if the PLAs or other chemicals that show up, and people think that they're making a good choice for an environmental and a health perspective and getting the paper looking packaging you might get at Whole Foods, for example, but we know that there's some chemicals in those linings. Could you guys speak to that a little bit?
Do you want to start, Leah? I would just say I would be concerned about the, any linings that are going to prevent leakage, that whether they're waterproof or greaseproof or, lining of cans, any linings are likely to contain the PFOAs and other similar chemicals. And I would be concerned about them.
I would just echo that the evidence of safety of these alternatives is wanting at best, really. So the message again is renegotiating our relationship with plastic and reducing.
Yeah. One more question that came up in the chat that I want to see if you guys have thoughts on. People are thinking about dishwashing of plastics that are considered safe. I know, Leo, you just echoed that in general we should move away from them, but are there any comments on, dishwasher safe number 5 plastic, for example?
there's no plastic that's dishwashing. The whole notion of microwave safe plastic that's on the label is for gross misshaping or warping of plastic at a microscopic level. All the things I talked about with the additives that are not covalently bound leaching out apply. And then you have this phenomenon wherein these polymers are not resistant all the way to 10,000 degrees Fahrenheit at temperatures that are part of dishwashing. With harsh detergents, you have breakdown.
And I just wanted to add, because somebody asked specifically about 5, the rhyme I heard, and I don't know, maybe it's changed, but was 4, 5, 1, and 2, all the rest are bad for you. Now, if that's okay, then it sounds like 5 is as good as 4 and 1 and 2. Do you have any other evidence about that, Leo? I don't know. That's an old saying.
No, it's an old saying, but I back away from it. Because with time, the science is telling us that what's in the 4, 5, 1, and 2 are not necessarily good for you.
Right,
and there are many hidden ball tricks that happen with the chemicals used in these plastic materials in the first place. So really, people are always shocked at our house where we barely have any plastic at all. And that's really an aspiration that we can achieve. It's not as hard as meets the eye. And you can follow some prominent people on social media who've really gone to extremes to show how it can be done.
Great, thank you. Miriam, did you have something you wanted to add? Last word?
I wanted to say that the environmental justice, food deserts, higher exposure paper has not been moved into the new Unwrapped website. I just realized, so I'm going to post it there, and you'll be able to find it there. And I did just want to say on the PLA issue, I think one of the big challenges is the lack of transparency from the companies that are producing these plant-based bioplastics in terms of, what are the additives in these products that help them either degrade or perform the functions that they do. So I think it's a big question mark. We just don't know. There isn't enough chemical transparency.
All right, well, time has flown by, so we're at the closing time already. So Dr. Trisande, Dr. Swann, Miriam Gordon, thank you all so much. We really appreciate you guys taking the time to share your research knowledge with us today. And as upstreamsolutions.org, I believe we just shared in the chat the Unwrapped conference website, Dr. Trisande's book, Sicker, Fatter, Poorer, and Dr. Swann's book, Countdown, are available wherever you like to get your books. You can also sign up for our newsletter if you'd like to find out about future webinars. We do these about once a month. And for those who do want to stay, we're going to put in the chat box a link to the Zoom line, where when you click on that, you're going to leave this webinar and enter a regular Zoom chat room, and we'll connect you guys with each other to have some speed networking, as we like to call it, and a chance to talk amongst yourselves and debrief the conversation we just had. So thank you guys all so much for the amazing work you do, both those of you listening and those who are on the panel today. World Health Day is tomorrow, so great chance to share a little bit in your communities about what you learned today, and have a great afternoon. Thank you all so much for joining us.
Thank you.
Thank you. Stay safe.